Thank you very much. I'm Biara, Wepukhulu, the MP Bulambuli constituency. I am standing in Mbale city at the Mbale Referral Hospital. I came to visit my local surgeons for circumcision who got an accident, and they got very serious. They sustained very serious injuries. And when I was moving around to look for them, I've seen there are so many things lacking. The building you see behind here is the ICU building that was meant to cater for some of the services that those who are critically injured can get treatment from here. But for a long period of time, it has not been worked on. And those who got injured, one of them has even passed on. Therefore, it is really an alarming situation. And when you really move around, I'm going to request my friend, Honorable Minister Balam. I was the one who first opened the anti-corruption crusade in Bulambuli, in my constituency, Bulambuli constituency. I think we don't need to stop in Bulambuli. And the way I'm seeing things, even the referral hospital, the only referral hospital we have in the sub-region, it is lacking. There is a lot of things that are lacking, and it is sustaining about, it is serving about 7 districts. So you can imagine. That is Namisindwa, Bududa, Manafa, Mbale district, Mbale city, Sironko, and the Bulambuli district. And then also the neighboring districts of Palisa, Budaka, and then Sorota, and then Bukede and other places. Therefore, we need to put to do an oversight role here. We identify what is missing, what is the problem. We table it on the floor of Parliament so that they allocate money which will be enough to cater for Mbale Referral Hospital. I know this is a constituency for my other fellow MPs, that is the Honorable Minister Lydia Wanyoto. We have Honorable Karim Masaba. But of course, this is a hospital for the entire sub-region of Bugisu. And I was coming to visit those who got injured, and the person who has the family that has lost one of the people who were attending to our ceremonies in Mutoto, the circumcision ceremony. But life matters most, and the health is for us all. Therefore, I call upon the government, being the regional whip of Bugisu sub-region. I'm going to table it through the office of the chief whip, through the office of the speaker, through the office of the president, so that we carry an oversight role here. We see things that are missing, and then we can help the people of Bugisu sub-region. And actually, the mortality rate in Bugisu is very high. Only in my constituency, every day, we bury 2 people. Today, as I speak now, we are burying in my own home, in Biara. There is someone who has passed on because of some of the challenges in the medical sector. Therefore, let us rectify our medical system so that it is effective enough to save the lives of all of them. Patients are even lying on, people are lying on the floor. People are lying on the benches which are supposed to be used as seats for those attending to the patients. But patients are lying on them with drips. I think you saw some of them. Therefore, this is not good for our health system if we are to serve Ugandans, if we are to provide for them a good health system to care for all of us. And by the way, we are not only thinking this hospital or my health center 3 of my hospital is for only those, the local people. Even us, I think you remember the story of the situation of Honorable Minister General Katumba Wamala, when he got the gunshots, when he got into those assailants, the border man who was on the first rescue carried him to the nearest health center. So you never know, even you, whether you are an MP, whether you are the president, whether you are the minister, anytime you can find yourself in this hospital. So let us prepare our hospitals good enough to cater for every Ugandan, not only thinking it is for the local people. Thank you.
Go to meeting.